So we're all familiar with the recommendation of getting an annual screening mammogram every year beginning at age 40. That actually only applies for average risk individuals. So that implies that you understand your breast cancer risk, and most people don't. So that's why it's so important to have these conversations. Olivia Munn has been really helpful in spreading awareness of the online calculator. Because if you are at high risk for developing breast cancer, greater than 20% lifetime risk, then we would start breast cancer screening as early as age 25 with an MRI. And then at age 30, we would add on a mammogram in addition to that, and kind of alternating every 6 months. So, by 40, you're way late if you are elevated risk for breast cancer. When we talk about breast cancer risk, there are modifiable and non-modifiable risk factors, which you can get into. But the big red flags would be breast cancer in a first or second degree relative, especially if it's premenopausal. Also known genetic mutations in the family, or a prior biopsy that was high risk in the breast. So that's a great place to start. A good rule of thumb is to start breast cancer screening 10 years before a first degree relative that was diagnosed with breast cancer, but not before the ages I stated. So if your mom was diagnosed with breast cancer at age 35, you would start MRI at age 25 and then add on a mammogram at age 30, alternating every 6 months.